Next, let's talk about the other restrictive procedure, the gastric sleeve. This is also known as the sleeve gastrectomy or the vertical sleeve gastrectomy. This is overall a newer procedure in the field of bariatric surgery, although it has been done for well over 10 years. It's the most commonly performed bariatric surgery in the United States. The sleeve gastrectomy is part of the duodenal switch. With the duodenal switch, we reduce the size of the stomach and we bypass some small intestine. The gastric sleeve is only the stomach reduction without the intestinal bypass. So with a gastric sleeve, we make a small narrow tube out of the stomach and the remainder over here gets removed. No intestine gets bypassed at all. After surgery, the patient will get full on very small portions because of the new smaller stomach. Here are the pros and cons of a sleeve gastrectomy. The sleeve is much better at reducing hunger than the gastric band. Sleeve patients will have fewer food intolerances than gastric band patients. There's no bypassed intestine after a gastric sleeve, and there's no implantable device. The risk of a sleeve is lower than the risk of a bypass, yet the rate of weight loss and the total amount of weight loss in many patients is the same. The follow-up regimen is not as intense after a gastric sleeve as it would be for a gastric band as well. Then on the downside, the sleeve, as I mentioned, is a newer procedure, and some patients can have worsening of GERD after a gastric sleeve. This is variable. Some patients have improvement in GERD and some patients have resolution in GERD after surgery, so it's difficult to predict for any given patient. A gastric sleeve is not adjustable and it's not reversible. Regarding complications after a gastric sleeve, the main thing we worry about is staple line leakage. We have to use some high-tech little titanium staples to seal the stomach off after a gastric sleeve, and in 1% of patients, in the first few weeks after surgery, one of these staples can leak. But this is not a long-term complication because after a few weeks, the staple line leak will be healed, so a patient doesn't have to worry about that in the long run, only the short run. As I mentioned in the last slide, heartburn can sometimes worsen after a gastric sleeve. Obstruction of gastric tube, this refers to an issue which can sometimes occur where there's like a kink or some swelling in the sleeve, which can lead to vomiting issues. The risk of death from a sleeve is very low overall. It's a little bit higher than for gastric banding, but at a rate of about 0.1 to 0.2%. This is similar to gallbladder surgery, for example. The incisions for a gastric sleeve are similar to what we looked at for a gastric band. The operation takes roughly about an hour. Most of these are done on an outpatient basis, which can include up to a 23-hour stay. After a gastric sleeve, your diet will be advanced a little more slowly than for a gastric band. Patients do a week of clear liquids afterwards, then 3 weeks of pureed foods, and then typically soft solids after that. Back to work after a sleeve is roughly about a week or two, unless you have a heavy lifting, strenuous type job. And then the follow-up regimen includes office visits roughly about every 2 to 3 months for the first year after surgery, and then twice in the second year, and then yearly after that.